Should I start? Okay. So, good morning, Your Excellencies, distinguished participants, dear colleagues. Thank you so much for joining this session. I'm Yukiko Nakatani, Assistant Director General of the Health Systems Access Data Division of the WHO headquarters. Before appointing WHO, I was in charge of the National Action Plan on AMR in Japan. So that is why I'm so great privilege to moderate this ministerial session on AMR at the One Health Summit and today's actions, tomorrow's solution on AMR. So as you know, the antimicrobial resistance is an urgent growing threat and undermining the modern medicines, food system development gains. The 2024 United Nations General Assembly on the Political Declaration AMR gave us the shared blueprint and actions, which is grounded in the One Health approach and includes the clear commitment with the target. Today's summit is our opportunity to turn that framework into concrete, tangible outputs and actions and deliverables that accelerate implementation. This session is to invite the distinguished speakers and to demonstrate concrete actions in their countries and to share their experiences and inspiring us today's actions and tomorrow's solution on AMR together. So to start today's session, it is my honor to invite Dr. Stéphanie Rist, Minister of Health of France, to provide an introductory remark. Minister, directly on the stage.
Mesdames et messieurs les ministres, chers collègues, Madame la directrice générale adjointe de l'OMS, Mesdames et messieurs les représentants des organisations internationales, des institutions financières, de la recherche et de la société civile. C'est avec plaisir et gravité que je m'exprime devant vous aujourd'hui. Nous sommes réunis ici à Lyon pour parler d'une évolution silencieuse, d'un phénomène majeur, d'un glissement progressif par lequel le traitement des infections d'hier pourrait ne plus aller de soi, d'un processus qui circule entre les humains, les animaux, les environnements, nos continents. Mesdames et messieurs, il y a près de 100 ans, Alexander Fleming découvre la pénicilline. Il le fait, vous m'excuserez de le préciser, après la découverte 42 ans plus tôt du français Ernest Duchesne. Avec eux, s'est ouverte une page de l'histoire de la médecine qui l'a bouleversée et dont nous risquons de nous priver de l'héritage. Car avec les antibiotiques, nous avons déplacé une frontière. Des infections autrefois cruellement banales et mortelles deviennent traitables et porteuses de guérison. Mais aujourd'hui, plus d'1 million de décès chaque année sont liés à des infections causées par des bactéries résistantes. 100 ans après la découverte de la pénicilline, l'antibiorésistance est une pandémie silencieuse. C'est une menace mondiale. Sans agir plus vite, plus fort et collectivement, ce chiffre pourrait atteindre près de 39 millions de morts cumulées d'ici 2050. Ce mouvement se fait déjà sentir dans nos hôpitaux, dans nos cabinets vétérinaires, dans nos filières agricoles et jusque dans nos milieux aquatiques. À terme, ce sont nos systèmes de santé, qu'ils soient bien dotés ou non, qui pâtiraient de notre inaction. C'est parce que vous savez bien tout cela que nous sommes réunis aujourd'hui. Je tiens à remercier l'ensemble des intervenants et partenaires pour la qualité des travaux préparatoires. Cette journée doit marquer un moment important, celui où nous transformons nos engagements internationaux en actions concrètes, partagées, mesurables. Nous savons que notre réponse ne peut être que globale, intersectorielle, coordonnée, et donc une seule santé. Cette conviction, nous la partageons tous ici, Mais nous devons désormais aller plus loin, plus vite et franchir des étapes décisives. Pour cela, il faut réunir un minima 3 conditions. La première condition pour agir efficacement, c'est de disposer de données fiables, comparables, accessibles au sein de systèmes de surveillance interopérables. La seconde condition, c'est de franchir une nouvelle étape, définir ensemble un cadre plus robuste pour la surveillance, son financement et le changement des pratiques. L'accélération de l'antibiorésistance est directement liée à nos pratiques. Les prescriptions inadaptées, les usages vétérinaires, les pratiques agricoles, les rejets dans l'environnement. Chaque acteur a un rôle à jouer. En France, nous devons nous-mêmes continuer à progresser. En 2024, nous étions encore le 2e pays européen consommateur d'antibiotiques. Cela doit changer et cela changera. La 3e condition, c'est de soutenir les alternatives. Protéger les antibiotiques existants est indispensable. Mais nous devons aussi veiller à ce que de nouveaux traitements puissent émerger. Aujourd'hui, le modèle économique des antibiotiques est profondément défaillant. Les traitements les plus précieux sont ceux qu'il faut le moins prescrire. Les antibiotiques innovants peinent à trouver leur place. Les laboratoires se détournent de ce domaine. Parce que les antibiotiques sont un bien commun thérapeutique dont dépend la santé de millions de personnes, la France a décidé d'agir avec force. Je souhaite aujourd'hui annoncer une mesure structurante qui marque un changement de paradigme. En France, 2e pays consommateur d'antibiotiques en Europe, cette réalité doit nous pousser à agir avec détermination. Notre réponse ne peut être que globale, intersectorielle, coordonnée, une approche une seule santé. Mais aujourd'hui, nous devons franchir une étape décisive, traduire cette ambition en action opérationnelle. C'est pourquoi je souhaite que soit créé un statut spécifique pour les antibiotiques, un statut construit avec les parties prenantes, un statut qui ne sera pas un outil communicationnel, mais un levier concret pour agir. Ce statut permettra d'adosser des mesures législatives et réglementaires pour structurer durablement notre action. Ce statut reposera sur 2 piliers. Premier pilier, garantir une offre thérapeutique suffisante et innovante. Nous mettrons en place une politique économique et industrielle ambitieuse pour favoriser l'émergence de nouveaux antibiotiques en santé humaine comme animale, en mobilisant pleinement les leviers existants, notamment au niveau européen. Pour adapter les règles de tarification et les modalités d'acquisition, en développant des approches plus coordonnées entre États, y compris à l'échelle européenne, et des engagements dans la durée. Pour sécuriser la disponibilité des antibiotiques essentiels, y compris ceux qui sont aujourd'hui peu attractifs pour les industriels. L'objectif est clair, éviter les ruptures, soutenir l'innovation et garantir l'accès pour tous. Deuxième pilier, réduire la surconsommation d'antibiotiques. En France, l'usage inapproprié en ville est estimé entre 30 et 50% des prescriptions. Nous renforcerons l'encadrement des prescriptions et l'accompagnement à la juste prescription en lien avec les professionnels de santé. Nous renforcerons également le rôle du pharmacien, notamment avec la dispensation à l'unité. Ces actions s'appuieront sur des données fiables et des systèmes de surveillance interopérables. Ces actions seront conduites en cohérence avec les travaux de la quadripartite. Nous devons changer de paradigme. Les antibiotiques ne sont pas des médicaments comme les autres, ils sont un bien commun dont la préservation dépend de notre responsabilité collective. Ce statut sera co-construit avec l'ensemble des acteurs. La France a la responsabilité d'agir pour ses citoyens, mais aussi pour contribuer à l'effort mondial. Avec ce statut, nous voulons faire de notre pays un modèle européen dans la lutte contre l'antibiorésistance. Les défis qui nous attendent nécessitent une mobilisation collective, durable, structurée et ambitieuse. Nous sommes réunis ici car nous avons une responsabilité commune, protéger l'efficacité des antimicrobiens, pour nous, mais surtout pour les générations futures. Je vous remercie pour votre engagement et je nous souhaite une session riche, constructive et tournée vers l'action. Je vous remercie.
Thank you. Thank you very much, Madam Minister. Please go back to your seats. And thank you very much for the hosting this fantastic event on the AMR. And also thank you very much for the expressing your commitment to take action in French. Thanks. So I need to stick with the timeline of this session. So I'd like to move on to the first panel session. I would like to invite the fantastic speaker to this panel. First speaker is the Professor Mustapha FERJANI, Minister of Health in Tunisia. Please come on the stage. Second speaker, Dr. Kunimitsu Ayano, State Minister for Foreign Affairs in Japan. Please come on the stage. Then third speaker is Professor Orazio Sukilaki, Minister of Health in Italy. Please come on the stage. And the last speaker is Ms. Hele Ingsland-Clarap, ICAR's Director of Operations, overseeing the partnership, communications, and organization development. Thank you so much. So, thank you so much to the speakers. And then, so I will give the floor to each speaker with one question each. Then please respect time, the 5 minutes, up to 5 minutes. Thank you. So, Minister FERJANI, what is your experience of Tunisia in implementing the infection prevention and control and the other prevention strategies in addressing AMR on the One Health approach? Please, floor is yours.
Merci beaucoup. Excellences, Messieurs les ministres, Mesdames et Messieurs, je vous remercie pour cette invitation de participer au sommet One Health à Lyon. La résistance aux antimicrobiens n'est plus une menace abstraite. C'est une réalité quotidienne dans nos hôpitaux, dans nos élevages, dans notre environnement. Face à cette menace systémique, la Tunisie a fait un choix stratégique clair. Adopter une approche One Health, intégrée, opérationnelle et orientée vers des résultats. Premièrement, agir à la source, par la prévention, par le contrôle des infections. Nous avons renforcé de manière concrète les programmes IPC dans les hôpitaux et les programmes Antimicrobial Stewardship dans les hôpitaux également, avec validation des prescriptions critiques et des antibiotiques de réserve qui ne seront délivrés qu'après avis et autorisation des experts en infectiologie. Des résultats ont été obtenus, une réduction mesurable des prescriptions inappropriées, une amélioration de la qualité de soins. Deuxièmement, étendre l'action au secteur animal et alimentaire. Nous avons engagé la surveillance de l'usage des antibiotiques, le suivi des pratiques d'élevage et le renforcement de la vaccination animale. L'objectif est de réduire la pression antibiotique à la source et troisièmement, construire une surveillance intégrée et digitalisée. Nous passons d'un système fragmenté à un système intégré avec la mise en place progressive d'une surveillance intersectorielle, un développement d'une plateforme numérique One Health. Et demain, cette plateforme permettra le partage des données en temps réel, l'alerte précoce et une décision rapide et coordonnée. Quatrièmement, nous avons renforcé la coopération internationale. Nous avons développé des collaborations avec les instituts Pasteur, un partenariat avec des instituts en Europe, comme l'Institut Teramo en Italie, des échanges de données sur l'antibiorésistance et nous avançons vers des solutions innovantes, notamment la phagothérapie, l'utilisation des phages pour épargner les antibiotiques. Aujourd'hui, je suis heureux d'annoncer le lancement du plan national AMR 2026-2030, basée sur 3 piliers opérationnels: gouvernance intersectorielle renforcée, surveillance intégrée et digitalisée, et généralisation du bon usage des antimicrobiens. Avec un financement initial mobilisé dans le cadre du Pandemic Fund, la Tunisie propose la création d'une plateforme régionale, Afrique du Nord, MENA One Health, et ça a été établi au cours de l'organisation en juin dernier par le sommet mondial One Health en collaboration avec la Banque mondiale et la déclaration de Carthage concernant les grandes lignes et les principes de coordination entre les différents pays dans le cadre du One Health. L'objectif, c'est le partage des données, la coordination des stratégies et le développement des solutions innovantes. Parce que la rame, c'est le bout de la chaîne. Les antibiotiques, les microbes, sont les êtres vivants les plus intelligents au monde. Et il y a quelques années, un auteur a écrit un livre, un bouquin, qui s'intitulait « Le monde appartient aux bactéries ». Tout va disparaître et restera les bactéries. Donc la rame est un test collectif. Aucun pays ne peut agir seul, mais chaque pays peut agir concrètement. La Tunisie a choisi l'action, l'intégration et le partenariat. Nous sommes prêts à travailler et avancer avec vous tous. Je vous remercie.
Thank you very much, Minister. Very concrete point that we have to action. Thank you so much. So now move on to the next speaker, Dr. Kunimitsu. So question to you is, what is the best practice could Japan want to share regarding the AMR surveillance and the use and the data for policy making? Over to you, floor is yours.
Thank you, Chair, Dr. Nakatani, and bonjour. And actually, Dr. Nakatani used to be my colleague at the Ministry of Health in Japan. I'm looking forward to your continued contribution to the AMR. And again, Excellencies and distinguished participants, I am Kunimitsu Ayano, State Minister for Foreign Affairs of Japan, and it is my great honor to deliver a remark on behalf of the government of Japan. And I'd like to express my deep respect for the leadership of President Macron for organizing this important summit, and Minister Rist here for hosting this session. My personal interest in global health was sparked during my time as a medical student when I visited 50 countries across Africa, Southeast Asia, and South America, assistance with malaria and HIV/AIDS research and health screenings. These experiences deepened my awareness of the social issues underlying illness. We gathered here today at a time when the world continues to face overlapping global health issues, from emergency infectious disease to the global impact of climate change on human and animal health. This challenge reminds us, again, that health threats are increasingly interconnected and that no country can address them alone. This is precisely why the One Health approach is more relevant than ever. We must strengthen the global health architecture to achieve health for all, including fostering prevention of, preparedness for, and response to further pandemics. Japan remains committed to global health as one of the key pillars of our foreign policy, protecting the life and dignity of every individual through human security. Prime Minister Takaichi placed great importance on health and medical security, recognizing that protecting people's lives and health is vital to national security. Today, I'd like to make 3 points. First, the importance of the One Health approach. Second, the Japan's contributions, AMR countermeasures, and health system strengthening. Third, our efforts to advance universal health coverage, USC. First, the importance of One Health approach. The fields of bacteriology and immunization are closely linked to zoonotic disease, such as influenza, mpox, malaria, and dengue. This underscores the importance of adopting a One Health approach to address communicable disease that threaten both human and animal, as demonstrated by the history of smallpox vaccination. Second, Japan's contribution to AMR, countermeasures, and health screening, health system strengthening. Japan took the lead to establish the regional framework for AMR countermeasures in the Asia-Pacific region. We will scale up initiatives including through WHO, and Japan continues to support WHO's growth system through the Japan Institute for Health and Security, JIS, established in April 2025. Likewise, Global Health Initiative for the research and development of new antimicrobial pharmaceuticals. We hope that independent panel on evidence for action against AMR will be launched with input from various countries. Japan has been making efforts to strengthen health systems worldwide as a major donor and continues to support multilateral frameworks such as UNDP, UNICEF, UNFPA, and WHO. We also collaborate with Global Health Initiative, including the Global Fund, Gavi, the G-HIT Fund, GADB, CARB-X, and Unit A, as well as non-governmental organizations, alongside our bilateral ODA project in the health sector worldwide. In advancing response to AMR, ensuring a stable supply of antimicrobial products is of utmost importance. To that end, it is essential to enhance our efforts to build and strengthen resilient and reliable supply chain for medical products among trusted partners. Third, advancing universal health coverage, or USC. Japan has been actively promoting the achievement of USC, ensuring that all people have access to effective and quality health service. This commitment aligns with the SDG's vision of leaving no one behind. On this occasion, I highlight two of Japan's recent significant engagement in global health. First, the Japan-France joint statement on global health was announced during President Macron's visit to Tokyo last week. The two leaders reaffirmed their commitment to strengthening cooperation in global health. Second, the UHC Knowledge Hub was launched in Japan in collaboration with World Bank and WHO. We hope the UHC Knowledge Hub fosters innovation by building capacity in health financing through the efficient mobilization of domestic resources from both public and private sectors. Modern medicine made significant progress over the world about 100 years ago that then Japanese and French bacteriologists crossed paths. Dr. Kitasato, who made significant contribution to bacteriology and immunization in Japan and the world, is now featured of the 10,000 yen banknote, met with Dr. Pasteur after studying bacteriology under Dr. Koho in Germany. Japan would like to contribute to the future of global health by sharing our experience and expertise, supporting health system strengthening, and promoting co-creation of innovative solutions. We believe global health holds strong potential as a foundation for international cooperation and trust between people. Thank you very much for kind attention.
Thank you very much, Dr. Kunimitsu, for showing your commitment and also insightful interventions on the glass surveillance as well. So I'd like to move on to the next speaker, Minister Shirasi. And the question to you is what model has Italy adapted to combat AMR, and what incentive mechanism is make effective in supporting for the innovation and improve access to the antibiotic? Thank you.
Honorable colleagues, Italy appreciates France's focus on One Health antimicrobial resistance, which is fully in line with the objectives of a previous G7 presidency, including Italy's in 2024. We also commend the complementarity of the international initiatives proposed at this summit, such as the International Pact to Preserve the Effectiveness of Antibiotics initiative, that we welcome as an useful step in turning renewed political attention on AMR into a more practical and results-focused process. We particularly value the way the proposal presents antibiotics as a strategic global health resource essential to the functioning of health systems. It's a key political message because antibiotics are not ordinary products. They are indispensable therapeutic tools, but at the same time, highly vulnerable to resistance, shortage, quality issue, and misuse. Furthermore, we appreciate the extension to the livestock sector, the proposed implementation architecture, deference to economic mechanism and equitable access, giving the pact real added value in terms of accountability, also feeding on to the UN General Assembly in 2029. However, we believe that emphasis on links with funded national action plans and a clear focus on inappropriate and unnecessary use would be much appreciated and more operational than an appeal for a general reduction in antibiotics consumption. The revised version of the Global Action Plan on Antimicrobial Resistance, GAP AMR, represents an important framework to guide the coordinated international efforts while ensuring that actions remain scientifically sound and adaptable to different national contexts, highlighting both strategic developments and operational priorities. This helps connect political ambition with practical implementation pathways. Italy's National Action Plan on Antimicrobial Resistance provides a common strategic architecture promoting a structured, accountable, and coordinated model focusing on a shared health, environmental, and agriculture governance, integrated surveillance and data sharing, stewardship, infection prevention, and the prudent use of antibiotics, and a measurable implementation. We strongly support the emphasis of interoperability between surveillance systems, ensuring that data from human and animal health and other relevant sectors can be used in a timely and integrated way for policy decisions. We believe cross-sectoral and international collaboration should be embedded in stable governance arrangements, preserving access to antimicrobial and encouraging innovation in therapeutics, alternative treatment, and rapid diagnostics, along with stewardship and prudent use and reduced inappropriate prescribing. AMR is not only a public health threat, but also a major economic risk, with substantial costs for health systems and national economies, as it increases productivity gaps, politically and sustainable financing commitments, and development safeguarding are critical in this regard. AMR, as shown by OECD, is one of the highest return areas for investment and should be a cross-cutting investment priority that could benefit from a coordinated scientific, financial, and political leadership. In conclusion, Italy stands ready to support efforts aimed at advancing a coherent, One Health-based, evidence-based, and financially sustainable global response, including by strengthening cooperation with the World Bank, the Pandemic Fund, and by supporting push incentives to promote innovation ecosystems such as CARB-X and pool incentives. as we have done at the national level in 2024, dedicated a 100 million euros fund for innovative antibiotics acting on multi-resistant germs classified as reserve according to WHO aware classification and bacterial priority pathogens list, and for which we have enlisted at least 7 antibiotics in 2025. Italy is adopting a pool incentives model to combat antimicrobial resistance, aiming to guarantee revenue for new antibiotics and ensure market access. As recognized inter alia by the Lancet, Italy is the second G7 nation to effectively implement and substantiate the linked pool incentives after the UK. We hope that such national steps could complement EU-level discussions on creating a cross-country pool incentives. Thank you.
Thank you so much, Minister, for sharing your experience, particularly pooled incentive systems. So next speaker, the Ms. Klarab. So in light of the ICARS focusing on the implementation AMR, so how are you bring collaboration with in-country partners and, for example, in Africa, to ensure the sustainable and the national ownership on their actions? So you have the floor. Thank you.
Thank you very much. Honorable ministers, esteemed delegates, ladies and gentlemen. First of all, I would like to thank France for hosting this One Health Summit and commend your strong leadership in One Health. I think it's clear to everyone that global priorities and realities are shifting, and this summit, with its focus on antimicrobial resistance, could not have come at a better time. Now, I represent the International Center for Antimicrobial Resistance Solutions, ICARS, and I would really like to thank the organizers for giving me the opportunity to present our work here today. ICARS was initiated by the Danish government in dialogue with the World Bank, realizing the need for an international organization working to close the gap between global policy commitments and implementation on the ground. We work with ministries, research institutions, and stakeholders in low and middle income countries across the globe to develop and implement solutions on AMR across the One Health spectrum. We provide funding and technical support, and our work is always based on national priorities and national action plans as we co-develop projects to ensure local ownership. Implementation of solutions is our core expertise. To date, ICARS has supported almost 70 projects in more than 30 countries, addressing AMR across human health, animal health, agri-food systems, and the environment. Antimicrobial stewardship is at the core of our portfolio. Responsible antimicrobial use in both human and animal health is critical. As we share pathogens, we live in a shared environment, and we rely on many of the same antibiotics. As the Honorable Minister Rist has already pointed out, in light of the dwindling innovation of new antibiotics, it is essential to preserve the effectiveness of the molecules we have. So today, I would like to share a few experiences and results from ICARS-supported projects in the animal sector. Firstly, in Zambia, over 200 poultry farmers trained across 7 farmer field schools have learned the basics of appropriate antimicrobial use and farm biosecurity. As a result, many farms reported stopping the use of antibiotics to prevent diseases, but without harming the health of their animals. And the business case was positive, as they have saved money also by not having to buy antibiotics. In this project, we also looked at the presence of antibiotics in the commercial animal feed that they were using, and the preliminary data in fact show that 100%, so all of the tested samples, contain tetracyclines. This highlights one of the biggest challenges for tackling antimicrobial use in feed in low and middle income countries. The presence of antibiotics is often not indicated on the feed labels, and this can in fact lead to sort of a double overuse. The access to antibiotic-free feed was also a challenge in the pork industry in Colombia. Here, the removal of routine prophylactic antibiotic use in sows, combined with vaccination and better husbandry practices, resulted in more than a 90% reduction in antimicrobial use, while maintaining, again, the animal health and productivity. Another example from Georgia, ICARS is supporting the implementation of a ban on antimicrobial growth promoters. And in this project, we're demonstrating that it is possible for farmers to stop using antibiotics as growth promoters and remain as profitable as before. Early results are promising, and a major industrial poultry producer has in fact committed to removing growth promoters across its operations. The project is also strengthening national capacity to monitor antibiotics in feed, which will be pivotal for tracking compliance with the ban. A final example in Vietnam, an ICARS-supported aquaculture project has demonstrated that fish raised in vaccinated ponds require 60% fewer antibiotics than those unvaccinated, and fish mortality was at the same time reduced by 34%. Now, these are all specific examples of initiatives we're supporting, but they do illustrate three very important elements. Firstly, with the right knowledge, evidence, and support, it is possible to build capacity, change behavior, and reduce antibiotic use. Secondly, we must take into account the economic case. Farmers need to see that their production is profitable and that they are able to protect the health of their animals. And thirdly, cost-effective, high-impact solutions to reduce antimicrobial use already exist, and they can be implemented, even in complex and resource-constrained settings. So today we chose to highlight examples from our work in the agricultural sector. We have similar projects and results in human health sector as well, working with partners to achieve more appropriate use of antimicrobials and prevent infections in hospitals, primary care, in pharmacies and communities across Europe, Asia, Africa, and Latin America. Now, to conclude, these lessons extend beyond national borders. They offer practical pathways for other countries to adapt and scale interventions. And the ambition of ICARS is really to synthesize this evidence and work to ensure that this knowledge translates into changes in policy and practices across region. And by doing this, it's our aim to contribute directly to the goals of the UN Political Declaration on AMR. Even if AMR is challenging and achieving solutions is not easy, we do have evidence to build on. We need to move forward with greater speed, stronger alignment, and sustained commitment. Solutions are within reach, and the responsibility to act relies on all of us. I think it's fair to say that the government of Denmark showed foresight when they initiated ICARS with a view to close this implementation gap. Now we're inviting other countries to join us in these endeavors, being part of the solutions to the global challenge, because together we can create sustainable impact and protect these life-saving medicines. Thank you.
Thank you. Thank you so much for the sharing the impressive example in the country. So, sake of the time, I need to move on to next the part of this session. So, please clap your hand for the excellent speaker. Thank you so much for your excellent intervention. Please go back to your seat. Thank you so much. Thank you. So then, instead of the open question to the floor, I would like to invite two colleagues from the GARP and CARB-X. So Mr. Jeffrey Rowland from GARP and Mr. Kevin Otterson from the CARB-X on the intervention on the private-public partnership. Thank you so much. Great. Great to see you. It's nice to see you. So my question very short to you for the what are the challenges and the potential solutions to promote for the effective public-private partnership to ensure the equitable access to the antibiotics?
Thanks very much, and thanks to the government of France for convening us today to talk about this incredibly important national and global health security issue. I'm Jeff Rowland from GARDP, the Global Antibiotic R&D Partnership. Together with CARB-X, we are the two global organizations that are addressing AMR from early discovery and R&D to all the way through phase 3 trials, as well as regulatory approval and access. And you've asked about access. We all are aware of the fact that Big Pharma has pulled out of antibiotic development, R&D. This job is being taken up by a handful of small biotechs. These biotechs really lack the capacity and the capital to be integrating equitable access in their R&D work. They're focusing on the science. So they're missing key elements like integrating vulnerable populations in their trials, like women and children, the ones who need these treatments the most. Thinking about planning for licensing, manufacturing, and registration planning. These are key elements to address access that both are cost-effective. You have to start from the beginning, as well as de-risking the science that they're producing. And this is where the public-private partnership model comes in to really help de-risk and provide quality assurance to those biotechs to support them to success. GARDP is an example of that. We take donor funding and pool it, and then we make very strategic investments and partnerships with biotechs to actually provide the quality assurance in the areas that I've mentioned and de-risk their work and then help them get to regulatory approval. We also do something very interesting, which is we take on the sub-licensing for lower middle-income countries or markets where these biotechs don't plan on selling their products. This is really important because it provides access and increased volumes for these companies that they then can turn a profit and make their business profitable. So this is important for business, but more importantly, this is important for people living in lower middle-income countries. Ironically, while stewardship and responsible use are incredibly important, the #1 reason that people are dying in lower middle-income countries is due to the lack of access to existing antibiotics. So GARDP and CARB-X work together to address that issue. The European Commission, the European Union, Europe is taking a leading role through DG HERA and DG Santé in supporting the likes of our efforts. We're grateful for that. While G7 countries have made very admirable efforts in both push and pull mechanisms, which are incredibly important, I want to highlight that in order to achieve equitable access, there needs to be increased funding in the middle, in the late stage R&D, helping biotechs actually deliver the science successfully, get it registered, and then facilitating access to broader markets that will provide the volumes that they can then turn a profit in. This is a win-win for donors by using strategic funding in a very targeted way, in a very high-value way. Secondly, for business, because it's a sustainable business model, but most importantly, because we're expanding access equitably to people who need it. Thank you.
Great. Thank you so much. For the Kevin, please.
I don't know if this one's on, so let me try this one. It's important to note that we always talk about resistance and how many people are dying from bacterial resistance, but really the broader question is bacteria. And bacteria kill more than 7 million people this last year around the world. It's the largest communicable disease category, more than any other. And so we need new antibiotics that deal with resistance, but we just need better antibiotics, and we need them to get to the people that need them. So we are grateful that, to be able to say that later today there'll be an announcement that GARDP and CARB-X welcome from the Commission, from DG HERA, announcing a new partnership which will involve the German Development Bank, in which CARB-X and GARDP will jointly share 30 million euros in order to advance our programs of making sure that the world has the sort of antibiotics that are needed to actually directly impact human health around the world. We think this is an important step because for CARB-X, we work on the earlier stages. We look at hundreds of projects and then work with them for years to the point in which they're ready for advanced clinical trials. And about the time the GARD-P comes in and other funders to then take it all the way to the conclusion. We're grateful for this work and for the ability to do that, and that the Commission has agreed to jointly fund us.
Thank you so much. Thank you. So thank you so much. Please go back to your seat. And then I moved on to the straight reader, the panel, next panel. So I invited the 4 speakers. Please come on the stage. First, Mr. David Wilson, Program Director at the World Bank Group. Please come on the stage. And the second one, the Professor Khaled Adel Ghaffar, for the Deputy Prime Minister of Egypt. So please come on the stage. And then third speaker, Mr. Jakob Forsmet, Minister for the Social Affairs and Public Health in Sweden. Please come on. Then last speaker is the Ms. Fabrizia Luperecola, for the Deputy Secretary General of the OECD. Thank you. Thank you so much. So I will move quick. So the question to the David, how can the World Bank and the other development banks help the position the AMR within the leading of the grant instruments and the country? Please.
Thank you. I will try to be quick, and just to say it's a pleasure to be here in Lyon, where the precursor to penicillin was discovered nearby at the military hospital. And you're right to pose that question, because AMR is an enormous challenge, not just to health, but to development, the core business of the World Bank. We estimate that unchecked, it would reduce GDP by 3.8%, increase health costs by 158 billion, and rob people of secure food supplies to the extent of 2 billion by 2050. So we have to act. But we also recognize that we as the World Bank have to act in concert with other MDBs, because we cannot fragment our efforts. We need to cohere and focus as we have never done before as MDBs. And together, using our capacity as MDBs to speak to finance and planning ministries and to relate to the whole of government, we need to support governments to build not just health or agriculture responses, but whole of government responses that transcend traditional sectoral barriers. And we have to work with the private sector. So many farmers get their medicines directly from the private sector without any regulatory oversight. That has to change. We are committing, as the World Bank, to redouble our efforts against AMR. We already have 34 AMR projects in 30 countries totaling 2.5 billion, and we have a $1 billion private sector livestock project, which is committed to making every intervention it makes AMR sensitive. And we also have published 20 priority actions for MDBs and countries to take to integrate AMR into each and every sector. And I think it's only through that combination of factors, MDBs working together, whole of government responses at country level, and truly innovative inclusion of the private sector, that we can together overcome AMR. Thank you.
Thank you. Thank you so much, David, for the keep of the time short. Thank you so much. The next speaker is the Professor Abdel Ghaffar. So you have the floor on the question, how the Egypt integrating the One Health approach in the ground?
Thank you, Dr. Nakatani, for moderating this important session. And thank you also to the government of France for organizing this important summit about the One Health. I think no one can now challenge the importance of One Health when it comes to health security globally. And for addressing this important topic, I think it's crucial to understand that, that we need to reduce the outbreak and pandemics from zoonotic diseases, and reducing the antimicrobial resistance, as the previous session was talking about. This is a silent pandemic that's going to threat around 10 million people by 2050. And at the same time, the importance of what we call it, the improving the food safety and food security and preserving of the environment and the ecosystem. Now we are even thinking about not just the One Health approach, but we're thinking about what we call it the health in all policies. Then this is exactly what Egypt is doing and presenting this protocol to the government just to emphasize the importance of putting health in every single discipline in the government, not just for the Ministry of Agriculture or the Ministry of Environment or Ministry of Planning. So this is important to mention, and I think the highlight of this summit is coming to this to focus in that particular domain. In this context, I guess the One Health approach has become a fundamental framework in every single policy of each government or each health sector, and certainly in Egypt as a global challenge. And these challenges demand integrated solutions that go beyond traditional sectorial boundaries, as we are here today to talk more about the implementation. So Egypt fully supports this vision and remains deeply committed to advancing the One Health approach as a crucial pillar for strengthening the health security and promoting the sustainable development and the preparedness for any future health threats. But how do we do that? I think over the last 20 years, the Ministry of Health and Population in my country has worked closely with both national and international partners to enhance coordination efforts that addresses the shared health risks at the human-animal environmental interface. I give you an example for that, Moderator, that Egypt hosted during 2022 the National Climate Change Conference, COP27. And during that time, we adopted and implemented the One Health approach strategy, and we led the effort for creation of a comprehensive multi-sectorial strategy that enhances collaboration among human, animal, and environmental health. Recognizing the growing importance of the institutionalizing of One Health, Egypt also launched the National One Health Strategy. And this has started 2023 for 5 years, and with participation from multiple ministries of my colleagues and national authorities as well. In this strategy, Egypt reflects to develop a resilient health system capable of addressing complex health threats through coordinated efforts. And we focused during that time on 5 strategic priorities. Number 1, to strengthening the One Health capacity and the multi-sectorial collaboration. And number 2, controlling zoonotic and vector-borne diseases. In addition to addressing antimicrobial resistance as a major global health threat, and enhancing joint risk assessment for food and water safety, and integrating environmental health and climate consideration into public health policies. And certainly, the silent pandemic AMR is one of the important. And I really admire my previous panelists who talked about investing more in research and development in new antibiotics. Yes, we are talking about antimicrobial resistance as a health threat. But again, we can also invest and finance a lot of research as regards to developing new molecules of antibiotics. And we also adopted a comprehensive strategies, and we worked together for a multi-level governance to support the institutionalization and coordination of the One Health approach, including ministerial committee, a Supreme Coordination Committee, and a technical work group representing all relevant sectors to talk and meet regularly to address this particular issue. At the same time, the financing, because I know that we didn't have time to talk more about the financing, but that's important to coordinate and ground the financing of this important sector within the budget of each Ministry of Health, and to talk about it in a collaboration way. Talking about in particular to antimicrobial resistance, I think this is important to cover the governance and accountability and the financial implementation, because we can talk a lot, but without having a financial support to preserve and to support the policy of One Health approach, I think that would be difficult. We also invested more in infection prevention control of our laboratories to help and support that particular issue of antimicrobial resistance, together with strengthening all the surveillance and the laboratory capacities and awareness of the workforce, because we can work together for the public, but we need our workforce also to have the proper awareness. I will stop here, but thank you so much for inviting me in such a prestigious summit. Thank you so much.
Thank you. Thank you so much for the Prime Minister. So for the next speaker, the Minister for Schmidt, the question to you is very simple. What is the priority strategy in your view at the national level, the EU level, and the global level?
That is a small question. But thank you so much to France for hosting this summit, and also to keep AMR in the center of this. I mean, this is such a great challenge for the world. It really threatens our way of life. It does it already when it comes to low access to people in low and middle income countries, but it also threatens the modern healthcare system. Not being able to have cancer surgery, not being able to save newly born kids, not being able to treat common infections. I mean, this is really puts such a stress on our communities that we just need to grasp. And I think we have so much that we have to do. I mean, already so many people are dying, millions from not being able to use the antibiotics. It's not working anymore, and millions because there is no antibiotics accessible to them. So we need to really face these different challenges at the same time. And therefore, we of course welcome the establishment of this pact. I think this is very good. It shows that many countries can come together, that multilateralism is alive, that we really need to come together to face these common health challenges. But I also want to emphasize that we also have some great documents already that we rely on. Take, for example, the antimicrobial, the use in growth promoters in the animal sector. I mean, this has already cleared, WOA has really clearly stated that this should not be allowed, this should be banned. We've had this ban in Sweden since 1986. 1986 we've had this ban, and it's really working. And we really should not be waiting for more declarations on this. It just should be banned at this moment. I think this is one of the most important things to do. Of course, on the national level, let me just share a few examples of what we are trying to do. Stewardship, of course. We have a peer review system in Sweden that I think is great, that the prescribing doctor is actually called by another doctor if his prescribing pattern is not in line with the treatment guidelines, for example. We have a system now delinking revenue from sales. So we link revenue to access instead of sales. That is also very, very important. We try to establish that on a Nordic level. We also try to establish common guidelines for treatment and common packages and things like that to make the markets more accessible. And of course, we work with funding and different new instruments on the European level, for example, with the transferable voucher. We really need this to help with the market failures that we see. And I think this is very important. Also at the regional level, today Sweden is announcing that we are supporting a new special advisor on AMR, Malin Groppe, on the WHO European level. I think that is also important to renew our commitment to this work. And of course, on the global level, I am pleased to be here as a Swedish minister, but also as the acting chair of the Global Leaders Group on Antimicrobial Resistance. And we need to keep the momentum going since the UNGA 2024. We need to have the international, the independent panel of evidence now established in the world, also to keep that momentum going, that there is evidence for this, and there is also action that can be done. So I'm also very much looking forward to the next ministerial meeting in Nigeria this summer. And let's just keep the momentum going, because this is a challenge that we have to face. Thanks.
Thank you. Thank you so much, the Minister Process. So next speaker, Mr. Rappe Corella. So quick question, how can we use of the evidence on the economic burden by AMR to translate action to policy decisions, or that's the experience for the economic burden? Thank you. The floor is yours.
Thank you. Thank you. Let me start by thanking France for hosting this important summit at a very timely moment, and for extending an invitation to the OECD to present our work on antimicrobial resistance, which is certainly today one of today's most urgent challenges in One Health. One that requires, we've heard that today all along, but I mean, I think it's important to have that in mind all the time, is a challenge that requires coherent and coordinated action across human health, animal health, agri-food systems, and the environment. And the OECD, our analysis shows that achieving global progress will require global investment of around $52 billion in the next 2 decades. Now, this is a huge amount of money, but it is certainly modest, and this I think is very important to note, if compared to the costs of inaction. And again, according to our analysis, AMR already imposes an annual burden of about $1 trillion per year through healthcare expenditures and productivity losses. On the other hand, it is important to have in mind that a One Health approach can generate substantial value, returning an estimated $11 for every dollar invested. And thank you to the Italian Minister of Health, Schillaci, for remembering that our analysis that point out to the value of investing in this area. So with all that, the question is, how can we accelerate action? We face serious gaps, a pledge gap and a policy gap. In September 2024, at the UN high-level meeting on AMR, countries pledged to reduce AMR-related mortality by 10% by 2030 compared to 2019 levels. But progress has been slow. And only 7 out of 25 EU countries, for which we have data, reported progress towards the national target on total antibiotic consumption. At the same time, national policy gaps persist, and these gaps hinder progress towards national and global targets. In 2025, only 6 of 35 OECD countries were implementing national guidelines for optimizing antibiotic use. Only 12 countries had infection prevention and control programs aligned with WHO guidelines. Now, it is to close these gaps. I am very pleased to share with you that we at the OECD, together with the WOA, the World Organization for Animal Health, we're launching a new joint initiative that can support countries in turning One Health ambitions into measurable outcomes. What we aim to do is work in 3 areas. First, promoting better use of data to close critical information gaps. An example is cross-sector information on how antimicrobial use in animals affects human health and economic performance. We will present this information through integrated publications and an online repository. Second, we aim at equipping countries with economic tools to assess the impact of antimicrobial resistance, including on livestock production, on health expenditure, and on wider economic activity. This we believe, will help governments prioritize interventions and plan specific, sector-specific and cross-sectoral specific investments. Finally, and there again, this was mentioned in the panel before by the acting executive director at ICARS, we will develop the economic case for cost-effective alternatives to the use of antibiotics. And how will we do that? By identifying best practices, by working with interest governments to demonstrate how targeted interventions can reduce antibiotic consumption while sustaining productivity. And while we at the OECD and WOA are ready to move forward with this initiative, we call on partners to help mobilize the resources needed to take this work forward. And let me close with a final point. I mean, I want to remember that, reiterate that antimicrobial resistance is a global challenge that no country can address alone, but we can turn One Health commitments into lasting results through shared purpose, strong evidence, and closer international cooperation. Thank you.
Thank you so much. Thank you so much for the excellent speakers. So please raise your hands. Thank you so much. Please go back to seat. So sorry, I have only 10 minutes and then 3 speakers. So next speaker is Ms. Sandra Gelina, Director General for the Health and Food Safety for DG Sante in the European Commission. And what are key strategies and operational points on AMR? Thank you.
Thank you. And Ministers, Excellencies, all protocols respected, I'm immensely honored to be here and to address you, even though briefly, as has been instructed to me. So basically, the One Health approach has long instructed the work of the European Union and especially the European Commission, and in particular DG Sante, where I have all the health above the soil, basically animals, plants, and also humans. We have, I would say, also done so with AMR targets. And I must say that I would like to pay tribute to Minister Forsberg, because under the Swedish presidency, Sweden is a very good pupil on that. We have, again, established targets for Europe that are extremely ambitious, and I would like to welcome the commitment by France on those targets. I would like to say that each country is unique in approaching AMR. All of them have different strategies, so I would also like to say that we have a joint action called JAMRAI 2, which is helping countries to stay connected with the global goals, with the shared goals of the European Union. Now, JAMRAI 2 has a mixture of things, and I want to mention 2 elements that are important. First of all is awareness. Many don't even know about JAMRAI, many don't even know about AMR, many don't even have an idea of the risk they are running. This is why, in the European Commission, and DG Sante in particular, we have gone towards, I would say, gaming. We have a game for kids called Catch the Bag, which was extremely successful. But we have also turned to arts, and arts, I would like to commend you to go to Place la République, where there is an exhibition which is trying to give you an idea of the stories of AMR. This booklet that I have shown has 30 stories of AMR, which I would recommend reading. We have also introduced AMR specifically and One Health in our Health Union Fellowship, where we have a group of young experts in all ministries of the European Union and beyond, trying to bring the latest on this. Obviously, the second element, so awareness, which is somewhat missing. The second element is innovation. And here I come to the big elements that we have tackled over the years. The first one was the reform of the pharmaceutical legislation. Here I pay tribute to the Danish presidency because it's under them that we succeeded in closing that huge piece of work. Here there are elements like stewardship. First of all, prudent use, which is very difficult to mature, but by law there is an obligation now for member states on the stewardship. The second thing that is very important is the pull incentives that we have put there, the famous transferable exclusivity voucher, which basically should be financing the production of new antibiotics. I would like to say that we have also referred to the subscription model in this legislation as a voluntary path, and we know that some member states have already embraced that path, and we wanted to make space for them in the legislation for that as well. But I would like to say that after hearing the fact that access is also important, the Biotech Act should be coming towards that gap of access that has been mentioned, the time to market. There are many biotech companies that produce, but they go through the valley of death, the startups, they die, and they don't come out with the product. So listen to me, Biotech Act, it's going to be the thing that will solve, I hope, the problem that we're suffering here in Europe. Capital going away, capital not staying in Europe, capital needs to stay here, and capital needs to be invested for products that we all need. Now, I come to the last point, it's the global level. The EU has been extremely active for the UNGA decision in 2024. I must say that I was personally not particularly happy with the result, but Minister Forsberg rightly said we need to ride the momentum, we need to go towards the independent panel, I agree. On the other hand, we should have also other countries in the world joining the very ambitious action of the EU in stopping the use of antibiotics for growth promotion in animals. And we know that that is an economic issue, and it's very difficult. I come to the last point for the international element, which is the work that my sister Yodi is doing. So I hope to be in Nigeria. We are going to have a big event. I hope it will be attended. I hope to have also more time than in this event to address these issues in Abuja on the 28th and 30th of June. So many thanks for your attention, and I hope I have been brief enough. Thank you.
Yes, Sandra. There's a fantastic, excellent handover to the Excellency. So now I'd like to invite Excellency Professor Mohammed Ali Parte for the Minister of Health in Nigeria come on the stage for giving the closing remark. But I apologize for the change of the order of the speaker from the Mohammed Parte because he needs to quit on 1:30 sharp. So floor is yours. Thank you.
Thank you. Excellencies, honorable ministers, ladies and gentlemen. I bring you warm greetings from my President, Bola Ahmed Tinubu, thanking President Macron, Minister Rist, and all other ministers in the French government for convening us to discuss this important subject. The theme of today's actions for tomorrow's solutions is very apt, building on the momentum 2024, which has been repeatedly cited, using the One Health approach and emphasizing that as a bedrock for our efforts to deal with antimicrobial resistance, which has been repeatedly mentioned as a silent pandemic. More than 1 million deaths, more than $1 trillion in terms of burden, and that's very important that we address it. I also would like to acknowledge the government of the Kingdom of Saudi Arabia, which hosted the 4th high-level ministerial meeting on antimicrobial resistance in December 2024. Our approach must therefore be very global, coordinated, and multi-sectoral in response to this challenge. But it also must be built on the country unit, country ownership, regional solidarity, and global solidarity. These are foundational so that we address this in a coherent manner and effectively. We are very pleased to host the 5th Ministerial High-Level Meeting on Antimicrobial Resistance in Nigeria in June 2026, from June 28th, 29th, and June 30th, 2026. Our approach is rooted in country actions, in African solidarity and global solidarity. We did have our own Yodi Alakija as a special envoy for antimicrobial resistance, who has been around engaging with all parties to ensure that we have a successful outcome, building on the momentum that has been gained since 2024. Our focus is really built on what we are doing with our National Action Plan on antimicrobial resistance, prioritizing the One Health approach, inherently multisectoral, with ministries of livestock, agriculture, environment, and health, and I chair the One Health Steering Committee. It's built on the idea of communication to engage, on coordination, but also capacities of our systems at all levels so that we work on this complex, wicked challenge that is ahead of us. It's also focusing on prevention, whether it's vaccination in the animal health arena or the human health arena, water, sanitation, but also guided by evidence, by the scientific evidence that we can garner from all avenues that have that expertise, promoting rational use of antibiotics and improving availability of diagnostics to differentiate what is bacterial, what is not, so that we can use antibiotics prudently. Thirdly, the issue of access. While the framing of it could be different in other climes, in countries like ours in the continent, I think we still have a large burden of disease and death that is contributed to by lack of access to antimicrobials. So how do we embark on the scientific path, the clinical research, identifying new antimicrobials, harnessing our own biodiversity to see how that can contribute in this global effort to emerge new tools for dealing with antimicrobial challenges that we face. Research and development is key. Innovation is key. So in the context of Abuja, we do expect to flag a platform that will allow acceleration in terms of innovation. Fourthly, the role of the private sector. We realize that the private sector is an important partner and was mentioned in the panel, not only in terms of private capital, innovation, and public and private partnerships in a very open and inclusive manner. And fifthly, rooted again on domestic financing of our health system, its resourcing, especially in the evolving global health financing system that is quite challenging. But we realize that dealing with antimicrobial resistance is not something in isolation. It has to be rooted in building resilient country health systems. That health security is linked to our ability to move towards universal health coverage. Our preparedness for pandemics is also linked to how well we have the institutions, instruments for surveillance, laboratory capacity, public health capacity to deal with antimicrobial resistance. So this is mutually reinforcing. And we thank the government of France for this leadership, and we look forward to its continued leadership, especially in its role at the G7, so that this agenda gets firmly rooted within that. And finally, I would like to extend a warm invitation to all of you here to join us in Abuja, end of June 2026, so that we continue to build on this important momentum, so that this agenda really takes root in actions at the country level, at regional level, and at global level. Thank you very much. Thank you.
Thank you so much, His Excellencies, the Minister Party. So I'm sure I will be in the Abuja at the ministerial meeting. Thank you so much. Look forward to see you. So the last, final speaker of this session, I would like to pleasure to invite the Professor Rod Darzi of Durham to present on the very hot topic, AI at the combating the AMR. Thank you very much for Dr. Rod Darzi for your patience, or the last speaker of this session.
Your Excellencies, Ministers, distinguished guests, ladies and gentlemen, may I begin by thanking the organizers of this remarkable summit and by acknowledging the vision of President Macron and Minister Rist in convening it, to bring together heads of states, scientists, industry, civil society under one roof around one agenda, and to do so as part of France's G7 presidency is an act of genuine political leadership. It is in that spirit that I want to speak today. about one of the most urgent tests of whether this agenda, this afternoon, can be translated from ambition into action. In 1928, a bacteriologist at St. Mary's Hospital in London, where I work, came back after a short holiday to find a contaminated Petri dish where a mold had spread and the bacteria had died. He called it penicillin. We called it a revolution. In 2 years' time, we will mark the centenary of that moment. And standing here in this room, I want to ask one question. What will we be able to say we did at this inflection point when that centenary arrives? I speak as the executive chair of the Fleming Initiative, a translational platform at Imperial College London in partnership with many global health organizations, including the WHO, where basic science, computational biology, clinical trials, health economics, and global policy work in genuine integration, not polite proximity. Our work rests on 3 pillars. The first is science, a research program spanning novel therapeutics, diagnostics, and resistance mechanisms, including diagnostics and dedicated artificial intelligence program in partnership with the best in the world, Google DeepMind. The second is translation, bridging the valley of death between discovery and clinical use. Because a compound that works in a lab but never reaches a patient is not a solution. It's a missed opportunity. And third is policy, because new antibiotics that cannot be accessed, reimbursed, or correctly deployed in Nairobi, Dhaka, or Lima is only half the answer. AMR has long been called a wicked problem. Its complexity, spanning human health, animal systems, agriculture, and the environment, is precisely why it belongs at the heart of the One Health agenda. But I want to offer a different way of seeing it. What we call One Health is, in reality, an enormous data ecosystem, billions of signals, genomic sequences, prescribing patterns, climate data, ecological shifts, human behavior. And for decades, that complexity has been our barrier. Today, it can be our advantage, because artificial intelligence gives us, for the first time, the capacity to see patterns we could not see, to connect systems we could not connect, and to act faster than we've ever acted before. Let me start with the drug pipeline and why it is broken. AstraZeneca exited in 2016, Sanofi and Novartis in 2018. The number of multinational corporations with active anti-infective programs fell from 18 to 6 in the space of 20 years. This may be rational for a firm. I believe it is irrational for civilization. Because the antibiotics we're not making today are the safety net for the surgeries not yet performed, transplants not yet attempted, and cancer patients not yet treated. We are quietly removing the load-bearing beams of a building while continuing to add floors. AI is beginning to change the equation. Deep learning models can now screen billions of chemical structures in days. But the true shift is not speed, is design. Generative AI is enabling the creation of entirely new classes of antimicrobials, compounds that do not exist in nature, with mechanisms that pathogens have never encountered. This is not iteration. This is invention. At the Fleming Initiative, we're working to reimagine the entire development pathway, from AI-enabled discovery and automated laboratories to smarter clinical trials, streamlining regulatory process, and intelligent commissioning, an end-to-end digitally enabled ecosystem. But a better drug pipeline alone will not solve this problem. And I've long believed that diagnostics are the key, because the greatest driver of resistance is not malice, it is uncertainty. What I mean by uncertainty is when a clinician suspects sepsis, there is 1 hour before mortality risk begins to climb, and yet diagnostic confirmation could take days. So we treat empirically and broadly, and sometimes unnecessarily. That is the engine of resistance. The goal must be diagnosis in minutes, and for the first time, it's becoming possible. At the Fleming Initiative, we've demonstrated that AI can increase diagnostic efficiency by 20% and deliver accuracy above 99% without additional laboratory infrastructure. But the deeper the transformation is not performance, it is access. Decentralizing diagnostics, moving them into clinics, communities, farms, and field settings is what is needed. And then connecting that data across human, animal, and environmental system into real-time intelligent surveillance. Our teams are now using AI to bridge one of the most critical gaps in microbiology, linking genotype to phenotype, predicting not just what the pathogen is, but what it will do. The ambition is clear, not to detect resistant pathogens after the fact, but to anticipate their emergence before they spread. And this brings me to something even larger, a shift in how science itself is done. Last year, working with Google DeepMind, we supported the development of an AI co-scientist, a multi-agent system that identified a mechanism of antimicrobial resistance in just 48 hours, a problem that took 5 human researchers 10 years to accomplish. And this is not a marginal gain. For me, this is a step change. What researchers now described as the 4th scientific paradigm, AI not merely as a tool, but as a collaborator in discovery. Combined with automated laboratory infrastructure, we're moving towards a closed-loop model of science, where discovery, validation, iteration happens continuously. For the first time, we may be able to match the pace of biological evolution with the pace of scientific discovery. Would you imagine that? What would Darwin say about that? But here is where I have to be a little bit more direct. The science is advancing, the tools exist. The question is not whether we can do this. The harder question is whether we hold ourselves and each other accountable for doing it. Because the pattern we keep repeating is the following. We identify the threat, we commission the reports, we convene the summits, and then we return to the system that rewards short-termism, protect legacy portfolios, and leave the gap between discovery and delivery entirely intact. Too often, it is the bedside that carries the blame, the prescribing clinician facing the patient, the underfunded hospital, the overstretched public health system. while the boardroom and sometimes the ministry escapes the burden. That has to change. Policymakers, and I say this to this room directly, must do more than signal. Signals don't work anymore. Adaptive regulatory frameworks for AI-enabled innovations are not a future aspiration. They are an overdue requirement. Incentive structures that make antibiotics development economically irrational are not market failures. I don't believe they are. They are policy choice, which means they can be changed. Industry must do more than calculate. We're proud to work with partners who are still in the game, and they're making significant contributions. But they exist within a sector where the dominant logic is retreat. This is not a natural phenomenon. It is the consequences of an incentive structure we designed, and we have been slow to redesign it. International institutions must do more to coordinate. Coordination without consequences is just a calendar management. This required collective ambition, collective courage, and willingness to be judged, not by the quality of the commitment, but what we actually built. In 2028, the world will mark 100 years since Fleming's discovery. What changed medicine was not the discovery alone. It was what followed. The collaboration between scientists, governments, industry, and willingness to invest, to scale, and to act. The geopolitical context then, fragmented, uncertain, contested, it's not different than where it is today. We stand at a similar inflection point. On one side, the status quo, lives lost, resistance spreading, response muted by short-termism and structural inertia. On the other, extraordinary tools, genuine will, and once-in-a-generation opportunity to build a system finally fit for the threat. The path we choose will not be determined whether we have the knowledge. We have the knowledge and will be determined whether we have the will. When we look back in 2028, I hope we will say we acted. We embraced the tools available, we built the systems to deliver them, and we laid the foundation that will protect lives for the next 100 years. Because if we do not do so, artificial intelligence in AMR will join the long list of opportunities we recognized but failed to realize. As I am in France, I'm going to try to say this in French. Les carottes sont cuites. We're not there yet, but the window will not stay open. Act now, act together, and let the centenary of penicillin be the moment when we proved that the lessons of Fleming was not just a discovery, but a commitment. Thank you.
Thank you so much, Darji. Please go back. So thank you very much. The strong statement on the science, which gives us the great hope and ambitious that together we can drive the tomorrow's solution on AMR. So thank you so much, audience, to stay in the auditorium until then. Then now the time to go to lunch. So the closure of this session. Thank you very much. So the apology, I doesn't have the time to open the floor, the question to all of you, but I'm sure you can have the opportunity to exchange these excellent speakers over the lunchtime. Thank you so much. Thank you.